Well, the July 4th holiday is just days away. In 1 week or less, a lot of folks are going to be setting off fireworks in celebration or watching them. But what do you do to keep your eyes safe? You need to think about safety this summer. It's so important. Ophthalmologist Dr. Robert Block from Acuity Eye Physicians and Surgeons is joining me once again. Now, doctor, let's talk about this because a lot of people, they're not maybe taking the right precautions that they should be. A lot of people think, you know what, we're just going to have some fun with fireworks. But this is really, really serious. What kind of injuries do you see?
Well, that's correct. So eye injuries account for about 20% of all firework injuries. There will be approximately 10,500 firework injuries. Most of those will occur in the 2 weeks leading up to the 4th of July and 2 weeks afterwards. Debris in the eye is going to be the most common eye injury. So that could be something from an explosive high in the sky that floats down like paper or particles, or an explosion that occurs too close to the eye and something is projected into the eye. A corneal abrasion or a scratch on the surface of the eye is going to be the next most common type of injury. That can happen from debris and somebody rubbing the eye, and they rub the debris and it scratches the eye. Or if the projectile hits the eye with enough velocity, like a bottle rocket or a Roman candle, something like that can cause a corneal abrasion. There are more serious types of eye injuries, like a retinal detachment. And so that would typically be an explosion close to the eye, or again, a rocket hitting the eye. That requires immediate attention and patient can lose vision as a result of that, typically requiring surgery to reattach the retina in an expedient manner. The worst type of eye injury would be what we call a ruptured globe, or a penetration of the eye by a stick or some type of small particle. Those can stay in the eye and be hanging out of the eye.
Now you have said that the most common injury is a burn.
Debris or a burn, that is correct.
Now I do have to ask you, if that happens, what is the first thing that somebody should do? Either a child's parents or a teenager, what's the first thing that they need to do?
So you need to try to assess whether or not it's something that requires immediate attention. So typically the pain level will tell you that.
Okay.
And if there's severe pain, then you need to seek medical attention for that.
Would the case be the same if you can actually see something in your eye?
Well, that's a great question, because if you can see something in the eye, do not try and remove it.
Okay, so don't touch it.
No. You don't want to put
a lot of people will just want to try and remedy the situation themselves, maybe with tweezers, but do not do that,
so
right?
I'll tell you an interesting story about this. I used to be on the trauma team at New York Eye and Ear Infirmary in Manhattan, and a patient came in complaining that they had pain in their eye, and when we looked at the eye, there was a fragment of metal projected into their cornea, in the eye and out of the eye. And so looking at this, we had one choice, and that was to remove it. Well, as soon as we removed it, the fluid from the eye started to egress rapidly out of the eye. If the patient had done that on their own, that could be a debilitating type of injury.
Right. You never know what's going to happen after.
Right. So I put a contact lens on the eye and had the patient close their eye, and the swelling from the wound in the contact lens slowed down the loss of fluid, and actually that patient ended up doing fabulous with no vision loss at all.
Well, that's good. That was very scary. Now, children are the most at risk for injuries when we're talking about fireworks, right?
That is correct.
What is the age range?
So 5 to 14-year-olds are going to suffer about 27% of all firework injuries, and 74% of firework injuries are going to be males.
So a lot of it does lie with the parents to sort of lead by example or keep reminding those kids, right?
Correct.
Is there anything particular that folks should keep in mind when you're talking about sparklers? Because those tend to be the most common ones that a lot of people use here in Connecticut, because many type of the exploding fireworks are illegal here in Connecticut.
Right, so you see fireworks everywhere, and the idea is that they're relatively harmless. However, they burn at over 1,000 degrees, and kids tend to whirl them around, and particles fly off, and they hit people. And so, again, a sparkler is not a harmless firework, and the best prevention.
They are very, very hot.
They are burning at over 3 times the temperature of water.
You figure, hey, they're for kids. They can, play with them.
Right. It's not a toy. It's definitely not a toy.
Yeah.
And the best way to prevent the injury is to not allow the child to have it. I know everybody wants that picture of their kid holding a sparkler on the 4th of July, but that's pretty dangerous, actually.
Yeah. Is there anything
So
else?
sparklers are about 10% of all eye injuries.
Okay. Is there anything else that folks should keep in mind? I mean, maybe, I guess, teenagers, if they're going to be using them, maybe sunglasses?
Right.
Protective eyewear?
Well, the Academy of Ophthalmology does recommend that anybody using fireworks wears protective eyewear. Most fireworks injuries are occurring at non-licensed events. So the safest thing to do if you want to enjoy fireworks is to go to a fireworks display. They'll keep you 500 feet away from the ignition of any of those fireworks. Rarely in a park or in somebody's neighborhood are you going to be 500 feet away.
Right.
And so 50% of people injured by fireworks are not actually igniting the fireworks themselves. They're just bystanders.
Oh, I didn't know that.
Yeah, it's
Wow.
very high rate.
Even though you do go somewhere where there is a professional doing the show.
Well, no,
You're still at a risk.
I'm sorry, the professionals, only 4% of all injuries occur when a professional is
Okay.
involved.
All right.
Okay, but if it's the neighborhood got together and bought fireworks, 50% of people will just be watching that will have those injuries.
All right. So definitely keep a safe distance.
Absolutely.
If you think you're safe, maybe take 10 steps back. Just
Or wear a
little
pair of
bit.
glasses.
Yeah, that's
Yeah.
a great idea. All right, Doctor, thanks so much. We certainly
Thank you
appreciate
so
your
much
time
for
and
having
all the
me.
tips. Stay with us. Much more Good Day Connecticut is on the way for you this Monday. Wall Street about to open in just minutes. So check on the numbers as the markets open after a rocky end to last week. So stay with us for that. Plus, security at several